90% of the world's malaria infections occur in sub-Saharan Africa. Mozambique alone has experienced 7.7 million confirmed cases of malaria and 504,000 deaths. Mozambique has a population of nearly 29 million people. Malaria represents around 45% of all cases in outpatient visits, approximately 46% of inpatient at pediatric clinics, and around 26% of all hospital deaths. The prevalence of malaria among children under 5 years is 46.3% in rural areas, compared to 16.8% in urban areas. The pervasiveness of malaria across Mozambique poses a risk to the entire population and threatens elimination efforts both nationally and in neighbouring countries.
I think the critical thing about malaria is it has to be a community or a government, national, local and community effort to actually reduce it.
We have a plan, a strategic plan, National Malaria Strategic Plan, to reduce by 40% of morbidity and mortality of malaria. We have 6 objectives. One is a program management. The second one is prevention. Prevention is meaning, the vector control. It's meaning LLINs and as well IRS, indoor residual spraying. Since last year, we start to use the acrylic as an insecticide.
Indoor residual spray, IRS, is a control method that involves specific application of insecticide on the inside walls and ceilings of homes. This can reduce the density and lifespan of adult vector mosquitoes so that they can no longer transmit malaria parasites.
The IRS is really an intervention that gets us to community level, that allows us to engage with the communities from a door-to-door basis. It's very important. Our teams are from those communities, and it really is ensuring that we protect the family by applying an insecticide to the walls of the dwelling to ensure that the mosquitoes that enter the house, sit on the wall, are then killed. We've been privileged to have a reduction in prevalence of more than 70% since then.
O programa de pulverização, na verdade, nos ajuda muito no combate à malária. Nós registrávamos muitos casos de malária no distrito. No entanto, com o programa de pulverização, só dando exemplo do ano passado, conseguimos reduzir o número de casos de malária em 45%. Então, isso é um ganho. Já não temos malária complicada e os casos reduziram em 45%. Então, se não tivéssemos o programa de pulverização no distrito, eu acredito que teríamos muita malária. Tá bom, a casa já está toda organizada. Podemos começar o passo de preparar a inseticida.
Actelic is the pesticide of choice for a number of reasons. One is it has a very long residual effect, so you need to only spray it on the walls once a year. The other thing is that at the moment, it is the only insecticide that can be used to which there is no resistance in the mosquito population.
It's an organophosphate. It's got a very good efficacy, and we've seen really good and significant reductions in both parasite prevalence and malaria cases.
The results in last season was very good in places where we sprayed. Even in some people that don't accept the spraying last year, 1 or 2 weeks after, when the neighbors or colleagues talk with them about the effect of insecticide, so they come to us and ask us to go to their house to spray.
The first benefit they see once a house is sprayed is a significant reduction in the amount of mosquitoes that come into their house and bite them. So they benefit hugely, and obviously in the case of malaria, if it's an off-leash mosquito biting the person, there's a very good chance that they might get malaria, and that reduces the risk of malaria as well.
The insecticide is an organophosphate in a CS formulation, which leaves a coating on the inner walls of the house. When mosquitoes rest on these walls, the coating kills the mosquito, so it cannot further spread the disease.
Então loko kuvutheliwa hititwana hi lidenge. Porque tisuna titafa, então a malaria
We did the entomological monitor, and the results up to 6 months was very good. The effects come down. Even in 7, 8, and 9 months, the effects going down. Okay, we used the first time the insecticide with the bottles, so we don't have a specific bag to keep the bottle for the spray operator. So the Arista provided that bags. It was very good. So the spray operator is feeling more motivated to use the new one, new insecticide, new bags, new equipment. It's very good.
Mina lexi xi ni tsakisaka ni tsakisiwa hi ku pfuna hi ku kombatela mavabyi ya malaria ni holuxa xitshungu. Hi lexi xi ni tsakisaka ni holuxa xitshungu ni pumba ni mavabyi ya malaria tikweni. Hi lexi ngopfungopfu xi ni tsakisaka.
É trabalho que você tem que se dedicar mesmo do fundo do coração. Não você aparecer por querer dinheiro, mas aparecer para ajudar a outros que não têm como se prevenir.
Arista Life Science is committed to improving the overall health and quality of life for the population of Mozambique and Africa at large, ensuring the healthy development of children and adults who are strong enough to contribute to society and the economy.
O mosquito causador da malária pode ser que esteja numa das salas, na frente das crianças, pode picar a criança e ela sofrer de malária. Agora, sendo que a escola também acolhe crianças e é necessário que realmente haja essa atenção.
Que o mosquito reproduz-se no lago e entra nas nossas casas para nos picar.
As malárias, e isso reflete, eles conseguem ver que nós ajudamos na luta contra a malária, por isso a população nos recebe com mãos abertas.
We also see wonderful impact effects in that when it is sprayed, the incidence of malaria really goes down, and even the nurses like it because they have less patients to treat in the hospitals.
Ku fana na leswi vuthelaka swivanana swa swinyingi ni va tinyimba va pona ka mavabyi ya malaria. Ja mina hi ku navela ka mina ni navela ku swi ya mahlweni. Hi leswi ni nga za ni tinyikela ka swona para ni kota ku pfuna vanhu na mina ni kota ku pfuneka.
Se loko a swi koteka ku va ku lwisiwa tisuna kusukela makwartela ya tona, ku lwisiwa tindhawu leti ku tshamaka mati lomu mugangeni, ku tlhela ku vekiwa leswa mabodi ya nsila leswaku munhu a tlakula nsila a chela ka n'wana ndhawu. Loko ku ni ndhawu laha yi fikaka yi cheriwa kona a swi ta yi swi ri kahle swinene. A hi ta ya phambeni hi ku lwisa makwartela lawa ya tisuna.
With the partnership with Arista, I believe that we can reduce more the malaria in Mozambique. But if we continue that partnership with Arista, with other partners to subside the insecticide, to provide training people, to support the training, to teach people to even the communities to change their behavior, to accept the IRS, their houses, I think we'll go there. Our fight now is to eliminate the malaria in Maputo province, in this province, and as well to reduce the burden of malaria in the center of North, where we have a prevalence around 60%.
I'm excited about what I've seen thus far. The reason being is that I believe there's a collective effort to really impact malaria and reduce it, and hopefully get to a point where we can eliminate or eradicate it.
Fumelani vutela, ati ndwini tawina.